Today, we're going to take things back a little bit, and I'm going to bring out my friend Virginia. Now, Virginia is a 66-year-old female. She's currently living comfortably in a small senior citizen community because, ladies, she is recently a widow, unfortunately. She is 5'3", and she weighs 165 pounds, which puts her BMI at 29.2, which, if I'm thinking correctly, puts her at the line of overweight. Within the last 5 years, she did suffer a heart attack. So she is currently under the care of a physician, and she's trying to take these preventative measures to prevent another heart attack from occurring because she does suffer from congenital heart failure, okay? She also has hepatitis C and COPD because, ladies and gentlemen, she's a smoker, right? A pack a day. Virginia suffers from COPD, which we know as chronic obstructive pulmonary disorder, which is due to the combination of bronchitis and emphysema. Both of these diseases are caused by her smoking. Many individuals diagnosed with COPD, they are long-term smokers like Virginia. And due to the fact that she is a smoker, this prevents her condition from improving. Symptoms of COPD include a constant cough, usually with mucus, shortness of breath. Sometimes they cough up some sputum. It is possible for the COPD patient to have an episode called exacerbation. This occurs when the patient's symptoms quickly worsen. If a patient experiences an exacerbation in office, they may have to go to the hospital as these attacks can be very dangerous. So symptoms of an attack like this include coughing up more mucus than usual, a change in the color or the thickness of the mucus, a shortness of breath more than usual maybe, and we do know that Virginia suffers that shortness of breath. So the most important thing she can do to slow down and possibly improve this condition would be to quit smoking, and that will also improve the quality of her life. She can slow down by eating right and exercising regularly. We really want her to take these precautions to improve her COPD. Mrs. Carson is currently under the care of a physician for congestive heart failure, or CHF. Heart failure is defined as the heart's pumping ability to become weaker than normal. The blood moves through the heart and the body at a slower rate, and the pressure in the heart increases. This prevents the heart from pumping enough oxygen and nutrients to meet the body's needs, ladies and gentlemen, so we know that this can be very dangerous. The chambers of the heart may respond by expanding to hold more blood to pump through them, and the body, and becoming stiff and thickened. So the expansion of these chambers help keep the blood moving, but will eventually cause the heart muscles to weaken and pump poorly. So when this occurs, the kidneys may respond by retaining fluids and salt in the body, resulting in edema or swelling. If enough of this fluid is accumulated, it can go into the feet, the ankles, the legs, and the whole body can eventually become kind of congested and almost swollen. This condition is caused by congestive heart failure. Heart failure can occur if a patient has coronary artery disease, has a previous heart attack, as we know Virginia does, high blood pressure, which we will assess in a moment, but Virginia does have high blood pressure. It can result from thyroid disease, diabetes, and a lot of other things. Heart failure can also occur if a patient presents with several symptoms at once. So due to Virginia's extensive medical history and the fact that she is smoking and her poor diet, her overweight, she may be suffering from this heart failure due to a previous heart attack and her high blood pressure. It is possible for the patient to not even experience any symptoms of heart disease or heart failure and only experience these mild symptoms. The symptoms can include congested lungs, dry hacking, coughing, wheezing, fluid and retention, like I did talk about that edema, dizziness, fatigue, irregular heartbeats. There are an extensive list of symptoms. She states also on her medical history that she's suffering from hepatitis C. Now, hepatitis C, as we do know, is an infection of the liver. Hepatitis C is a virus that spreads through the blood or the bodily fluids of the infected persons. It can be transmitted by sharing needles, sexually encounters, or from a mother to a baby during the birthing process. Hepatitis C sometimes doesn't really have a lot of symptoms, but it can be diagnosed through a blood test. the hepatitis C can develop into a long-term condition called chronic hepatitis C, and it can lead to liver cancer and liver cirrhosis or even scarring of the liver. Interferon and riboflavin are commonly used as main treatments of hepatitis C. However, these drugs can cause a patient to feel fatigue, have flu-like symptoms, anemia, mild anxiety, a skin rash, depression, nausea, and diarrhea. After this short break, we're going to bring on a very special guest, Patty Johnson, our expert hygienist, who's going to talk to us a little about Virginia's medications and the treatments for some of her conditions, as well as how to manage those conditions in a dental setting. So stay with us, ladies and gentlemen. We'll be right back. Hello, everyone. Thanks for coming back to us here at Carrie Springer. This is my friend Patty Johnson. She's an expert hygienist, and she's going to help us to discuss a little bit more about Virginia's medications. I understand Virginia's taking a long list of meds, including Tenormin, Lanoxin, Vasotec, Advair Discus, Lasix, and Stress Tabs multivitamin. So tell me more. What is Tenormin usually used to treat?
Okay, Tenormin is usually used to treat high blood pressure. It can also be used to treat angina and to improve the survival after a heart attack.
Which she had.
Correct. It can also be used to treat irregular heartbeat, heart failure, and alcohol withdrawal symptoms and prevent migraine headaches.
Interesting.
When this patient does take this medication, they should not be taking it with apple or orange juice, as it may prevent the body from fully absorbing it.
Oh.
Now, when the patient takes this medication, they should be taking it to 1 to 2 weeks before the patient receives the full benefit. This medication can cause dizziness, lightheadedness, tiredness, nausea, and xerostomia, which is dryness of the mouth.
Oh, sounds gross.
Yeah, this medication can also reduce blood flow in the patient's hand and feet, causing her to feel cold. Oh. Smoking can worsen this effect. So this is a major interaction consideration for
Virginia.
Yeah. Absolutely.
So to be avoided.
Yes, this patient should also be aware of all the medications that they are taking while taking Tenormin. Because medications such as cough and cold products, diet aids, NSAIDs, they could all contain ingredients that could increase the patient's heart rate, blood pressure, or worsen heart failure.
And we don't want that because this is used to treat high blood pressure, as you said, which she has.
Correct.
Do you know what was her blood pressure reading?
It was 142/94, so she is stage 1 hypertension.
Oh, all right. Sounds a little.
Yeah, we're gonna go into depth with her when she's out here about her hypertension.
So what about the Lanoxin? I think if I recall seeing it on a commercial, it's used to treat that heart failure she has. I think.
Yes, it's a cardiac glycosides. And it's used by affecting certain minerals such as potassium and sodium inside the heart cells. It's used with other medications to treat heart failure. When heart failure is being treated, the patient's ability to walk will be maintained and the physical activity will improve as the heart becomes stronger.
Which is important for her because she seems like she's like
she's having difficulty getting to point A to point B.
Okay.
It can also be used to treat chronic atrial fibrillation and irregular heartbeat. This will reduce the patient's risk of a heart attack or stroke.
Oh, that's important because she did just have that heart attack and we want to keep her as healthy as can be. So, and then another medication is the Vasotec, which is for what is that for?
Vasotec can be taken alone or in combination with other medications to treat high blood pressure. It can also be used with other medication to treat heart failure.
Oh, and she has both of those things, so I'm sure this is a great medication for her if she's using it as prescribed.
Yes, but there are some common side effects that she needs to be aware of, such as blurred vision, sweating, and weakness. The less common side effects include cough and producing mucus and labored breathing, both of which Virginia has.
Right, because of that COPD.
Another important side effect healthcare providers should be aware is orthostatic hypotension.
What is that?
So orthostatic hypotension is when someone's laying down, like in the dental chair, and as a hygienist, we want to be concerned about for when we're finished with the dental appointment, we're sitting them up, and the patient may get up too quickly and become lightheadedness. So it's really important that they take a moment once they're seated upright to get the blood rushing before they stand up and fall and hit their head on some dental instruments.
Always want to prevent a medical emergency is the main goal here.
It is also recommended that patients taking the Vasotec that have a liver dysfunction get frequent liver function testing.
Oh.
Because Virginia does have hepatitis C, which can lead to a liver dysfunction, she may need some liver function testing in the future.
Right.
When taking this medication, it is also advised to avoid food with high potassium.
Bananas.
Exactly. This can cause high levels of potassium in the blood. The Vasotec can higher levels in the effects of Lanoxin, which is also what Virginia is taking. These medications can be used together, but careful monitoring is necessary. Vomiting, visual changes, uneven heartbeat, and loss of appetite can be signs of excessive Lanoxin levels.
Okay.
Virginia should seek medical attention if any of these symptoms do occur.
Gotcha. Now she's also taking that Advair Discus, which is that an inhaler?
It is an oral inhalant that contains fluticasone, which is an anti-inflammatory and long-acting bronchodilator. Both work together to improve lung function so you can breathe better. This helps prevent COPD symptoms such as wheezing and shortness of breath.
Okay.
Common side effects include hoarseness and voice changes, throat irritation, headache, and viral respiratory infections.
Ooh.
Fungal infections can occur with the use of it, so it's important to rinse your mouth after you use it.
Okay. What? And then
That will prevent chronic candidiasis, which is an infection of the mouth and pharynx.
Okay. Last prescription medication that Virginia's taking is the Lasix. Now, what is Lasix? What is it used for?
So Lasix is a loop diuretic. It's like a water pill that prevents your body from absorbing too much salt, allowing the salt to instead pass through your urine.
Okay, so instead of retaining it, building up that edema.
Correct. It treats fluid retention, such as the edema that you mentioned, in people with congestive heart failure, liver disease, or a kidney disorder such as nephrotic syndrome. This medication is also used to treat high blood pressure, which Virginia has been experienced from that stage 1 hypertension. When people take this medication, they should avoid getting up too fast.
It's a common thing with all these.
Yeah, it's like the orthostatic hypotension.
They may feel dizzy.
Yeah, so they need to be careful.
Like faint.
Yeah, even when they're not being in a dental chair, they need to be careful even at home when they're getting up from the couch
Okay.
for the orthostatic hypotension.
And now the multivitamin, she's taking, I think it's called stress tabs. And multivitamins, from my understanding, they're vitamin supplements, but you want to always consult your doctor before taking them. Am I right with this? Minimize for stress, keep it at low levels, but you should always consult with a physician before taking a multivitamin.
Correct.
Awesome. So we're going to bring Virginia back over here, and we're going to have them all talk together after this short message. So stay with us. And welcome back. Thanks for rejoining us. It's time to bring out my friend Virginia. Virginia, can you come out? Welcome Virginia to the stage. Cigarette. Virginia, for goodness sake, we're on the air. Put the cigarette out.
Can't smoke nowhere no more.
All right, you can take a seat on my plush stool.
Hi,
So how are you
Virginia.
today?
Thanks.
Are you good? Do you need help? Okay, good.
I'm a lot of breath. I haven't walked that much in years.
Okay, take a deep breath. Everything's gonna be okay. This is my friend, Patty Johnson,
Hi, Virginia.
expert
Nice to meet
hygienist,
you.
and I'm gonna let you two hash things out.
Hold
Okay.
this for me, Jesus.
Okay, Virginia, tell us a little bit about your chief complaint. What brings you into the dental office?
Well, I don't like coming to the dentist, but my nurse is telling me I got severe halitosis. I don't know what that is. What is that?
It's bad breath, honey. Bad breath.
I got bad breath. And my denture, it just doesn't look right. It has a weird, unnatural appearance. And it's loose. I blew out my birthday cake and my dentures fell out.
That
No.
needs to
Okay,
be
well,
addressed.
Patty here is really
It
gonna
was
help
very
you.
embarrassing.
I'm sorry you experienced that. But first, before we start with anything with the dental, we need to address any medical issues that could occur, like any medical emergencies. For your blood pressure is stage 1 hypertension. That kind of correlates with your BMI. BMI is your body mass index. You are right on the line to being obese. What we want to do is we want to lower your BMI, which will also lower your blood pressure. Those two will lower with each
They
other.
correlate.
Yes, they do. They will lower once you start to lose weight. Your blood pressure should drop.
I knew I had some few extra pounds.
Another issue that we want to address is that you had a heart attack within the last 5 years and you're suffering from congestive heart failure. We need a medical clearance from your doctor to continue on with your dental treatment. We see that you're wheezing and you're struggling to get into the chair, so we want to make sure that you are comfortable and that we assist you by using towels while you're sitting in the chair. We want to keep you at a semi-supine position so you don't choke with your wheezing. We also,
I wheeze a lot.
I noticed. So I also want to make sure that your orthostatic hypotension doesn't occur, and that's when we're sitting you up in the
I
chair.
thought I had hypertension.
Hypertension is your blood pressure. Orthostatic hypotension is when you get lightheaded from sitting up too fast. So we're just gonna make
That
sure.
happens.
Yeah, we're just
So
gonna
be
make sure
careful
that
with
does not happen in a dental office by we just letting you sit there a minute or two before you stand up. You say that you are a heavy smoker and you smoke a pack a day. Is that correct?
The doctor told me I should try a smoking cessation, but I don't know about that.
We would highly recommend you doing the tobacco cessation program. Since you do smoke, we're going to ask that you do an oral cancer screening at home, which is just you're going to take your tongue and you move it to the side, left to right in a mirror, and look for any lesions that would start way in the back, but at the side of your tongue.
Have cancer?
No, it's a
no.
preventative measure.
Yeah, we just want to make sure that oral cancer doesn't occur from your smoking, but we would highly recommend that you cut back or stop. Just work your way.
It's hard.
We know. This why this program would help you. And
That's
it
why
would
I lost
benefit.
all my teeth.
Oh, that's unfortunate.
I know that you're also, you said you don't like coming to the dentist. What can we do for her about that?
Do you know why you don't like coming to the dentist?
I don't really know why I don't like dentists. It's probably because you people are scary.
Okay, well, what
And
we'll do is...
There are a lot of noises.
Oh, okay. So what we'll do is we will walk you through everything that we do so therefore you feel more comfortable and you are aware of your surroundings, of what's happening.
So you gonna tell me when you're gonna scrape my teeth?
Yes, we will keep all your appointments to the minimum of stress, so therefore you don't have any heart issues or your heart rate doesn't increase.
So probably in the morning.
Yeah, we're going to keep your appointments in the morning so you don't think about it all day. So we're going to address it right.
Keep stress at a minimum for you. We don't want you to be stressed, Virginia. We want everything to go smoothly.
Yeah.
Now what about that denture? You said something about your denture.
Oh, well, the lady said maybe my halitosis is due to my nasty denture.
Oh, what do you have to say about the
Okay,
denture
so
and the
we would
halitosis?
highly recommend that you get the dentist to examine your denture to make sure the denture is fitting properly. Your halitosis could be from your coated tongue from smoking, so we would recommend using...
I got coated tongue.
Yeah, you have a coated tongue because of all the tobacco and you're just not brushing properly. I think you said that you just brush once a day.
Once, 2 times on occasion, sometime maybe.
When
Well,
you
you
have a
should be-
fancy event 2 times
Yeah,
a day.
you should really be brushing 2 times a day for 2 minutes at least. And then we're gonna go ahead and
Even though I only got the bottom?
yes.
Mhm.
Then we're gonna go ahead and put in a tongue scraper that we'll provide with you, and we'll go through how to use it to get that extra coating off your tongue from all the bacteria.
And also, in regards to the denture, you said it's unnatural. So what characteristics would you like it to have? Since you saying you
Well-
wanted to match your bottom teeth more?
Well, yeah, my bottom teeth are yellow from smoking, I guess.
So
and my
maybe
top
adjust the
denture
color.
is so white,
Okay.
like they look fake.
So we'll definitely adjust.
Yeah, the dentist will be
I
able
can't
to.
get a boyfriend.
Oh my
A
gosh.
shame.
We'll
I'm
have
a
the
widow.
I'm so sorry.
We'll have the dentist look at that. For your xerostomia, we're going to go ahead and give you a Biotene, which is like a mouth rinse. And that will provide your oral cavity to be more moist throughout the days.
Which might help with your halitosis because when your mouth is dry,
Oh,
you
that,
know,
yeah,
try and increase your water instead of chewing on sugar candies. I know you ladies love those sugarless candies, so try and stick to more water and definitely use that Biotene as Patty said.
Correct.
Now, what else are we going to address?
So we're going to go over back to your brushing your teeth 2 times a day. It's very important that you do that so you get all the bacteria out. That will also help with your halitosis. You mentioned that you don't floss because the floss cannot go in between your teeth.
Nope.
Well, looking at your intraoral photos, you have a huge bridge of calculus. That is
Calculus?
yeah, that
The
is.
subject?
Calculus is actually mineralized plaque, and the only way to remove it is from it mechanically. You cannot remove it with your toothbrush. That's why it's important that you see your hygienist 2 times a year. But in this case, we might have you come a little bit more frequently. So once that bridge of calculus is removed, you'll be able to floss properly, and we recommend that you do that at least once a day. For cleaning your denture, you need to make sure that you're taking it out every night, and you're brushing it with a denture toothbrush, and you're using dentifrice.
Oh, the cleaner. I use
Yes.
Yeah.
yes,
Good, but make sure
exactly.
you're using it every night. Soaking
Yes.
and taking it out at night's important to keep your breath fresh and your
And
mouth
that'll
clean.
also
Good
prevent
idea.
from a fungal infection from occurring.
A
Like
fungal infection?
correct.
In
Like
my mouth?
Yes, like candidiasis. Candidiasis can be formed from the ill-fitting denture, or it can be from the oral inhaler that you're taking. If you're not rinsing after,
My Advair?
yes,
your
you need to
Advil,
take.
yes.
Once you take that, you need to rinse with water to prevent the infection from
Oh, I
occurring.
never do that.
That'll help you with your candidiasis. Also, we're gonna have the dentist possibly prescribe you nystatin, which is a medicine to treat that. Your bleeding. You have spontaneous bleeding.
I sure do.
So once you're doing your brushing and your flossing and using your tongue scraper and keeping that oral cavity clean and cutting back on smoking, that'll prevent your bleeding from occurring so frequently. You do have some caries present that we're going to go over later
Caries? Isn't that your name?
I am. That's me. My name is Caries.
on. Yes, so you have some cavities, so we're going to go over them. And we're going to like to ask that you get them
How do you get cavities?
from fermentable carbohydrates and from sugar, not brushing properly, leaving the bacteria on your teeth. It's really important that you take care of all that stuff to prevent your cavities from worsening and from new ones occurring. So we're gonna give you a referral to the dentist to set up.
Appointment to fix my caries?
Yeah.
Absolutely.
And also, you said you were using a fluoride toothpaste, which is great. I would really encourage, not that I'm a professional, but the use of a fluoride toothpaste to prevent further cavities. Because
yeah,
I already used the toothpaste.
good, that's awesome. I would just recommend keeping with the
Yes.
Continue
to prevent
doing
further cavities.
Seems like a lot, ladies.
Well,
You
we're
can
going to
do it,
go
Jenna.
ahead and get you in about a week, and we're going to do a scaling and root planing of quadrant 3, and then we're going to bring you in like a few weeks later for your last quadrant.
Am I gonna have to be numb for that?
Well, wait a minute. Since you do have CHF and a number of other conditions, the use of epinephrine might be
Limited. So we're going to
right.
give you the cardiac dose, but we're also going to consult your doctor, your physician,
To make sure
before
it's
we
okay.
do anything. After we're done debriding your mouth, we're going to refer you to the periodontitis because you do have some very deep pockets that he'll be able to assess you further and to prevent them from worsening and to improve them. And after we do that, we are going to have you come back for a 4-week reevaluation to assess your tissue and your periodontium. And then we're going to have you come back in 3 months, and we're going to have that be your regular dental appointment every
So I
year.
gotta come back every 3 months?
Yes,
Yes,
we're going to
because of
have
your
you come.
condition.
Yes, we're going to have you come back every 3 months instead of 6 months because your oral condition is the way it is. It's in the current situation.
But we really want to get you back on track. So
Yes.
we'll see. We'll bring it back on the air in about 4 weeks for your reevaluation.
After
And
my reeval?
yes, so thank you so much for joining us today. We hope
Shout
to
out
get
to Ray Ray!